Okay, good day ma'am. Today I'm going to perform assessment of peripheral vascular system return demonstrations. Okay, let's start. Let's prepare for the knowledge. Okay, so I need to describe the structure and function of the peripheral vascular system. To perform a thorough peripheral vascular assessment, the nurse needs to understand the structure and function of the arteries and veins of the arms and legs. The lymphatic system and the capillaries. Equally important is an understanding of fluid exchange. Okay, so before we going to start the procedure, I need to introduce myself to the client. So, good day ma'am. I'm Joyce Aluya Goto, your student nurse of CSPC. Next is verify the client's identity. So ma'am, what's your name po?
General Assembly.
Okay, and your birthday po?
May 16.
Okay, and then explain to the client if what I'm going to do or the procedure. So ma'am, later on, I will be assessing your peripheral vascular system. So, I will inspect you po and palpate. May mga part po na hawakan ko po yung kamay nyo at yung paa nyo. Okay lang po ba yun? Okay, so next is gather the equipment. So, here are the equipments that I need to use. Okay, and then next is perform hand hygiene. Okay, and then after that, provide for client's privacy. So assume that we have a curtain and need to close it. And of course, the door, we need to close it to have a client's privacy. Okay, and the next is inquire the client for her health history. Okay, so this time I need to gather the subjective data of my client. So ma'am, I have some question. So it is okay lang po? Okay. Okay, so have you noticed any color, temperature, or texture changes in your skin? May mga pagbabago po ba sa color ng inyong skin, sa temperature, sa texture? Okay, so do you experience pain or cramping in your legs? Okay, so have you had any heart or blood vessel surgeries or treatment? Okay, so for your family history po, meron po ba sa inyo may cholesterol or triglyceride levels? Okay, so for your lifestyle and health practices po, do you smoke? Okay, hindi naman. Okay, so do you exercise regularly po? Okay, so after gathering the subjective data, let's proceed for the objective data, which are the physical examinations. Okay, so let's proceed for the physical examination of the peripheral vascular system. Okay, so let's start. Inspect arms bilaterally for size, presence, edema, and venous patering. Okay.
Arms are bilaterally symmetric with minimal variation in size and shape, no edema or prominent venous patterning.
Okay, so next, inspect bilaterally for skin color. Inspect fingers for clubbing.
Okay, color varies depending on the client's skin tone, although color should be the same
And then
bilaterally.
next, palpate fingers, hands, and arms for temperature using dorsal surface of my fingers.
Skin is warm to the touch bilaterally from fingertips to upper arms.
Okay, and then next, determine capillary refill time.
Okay, capillary beds refill, and therefore color returns in 2 seconds or less.
Okay, and then next is palpate radial, ulnar, and brachial pulses.
Okay, radial pulses are bilaterally strong. Artery walls have a resilient quality. The ulnar pulses may not be detectable. Brachial pulses have equal strength bilaterally.
Okay, and then next, palpate for epithelial lymph nodes.
Normally, epiclear lymph nodes are not palpable.
Okay, so next is perform Allen's test.
Okay, pink coloration returns to the falls within 3 to 5 seconds if the ulnar artery is patent, and
Okay,
pink
close mo
coloration
po.
returns within 3 to 5 seconds if the radial artery is patent.
Okay, so next, let's Okay, so next for the legs. Okay, so let's start for the physical assessment of the legs. Okay, so inspect bilaterally.
Inspect bilaterally for skin color, distribution of hair, lesions or ulcers. For edema, and lateral or bilateral. Okay, pink color for lighter skin clients and pink or red tones visible under darker pigmented skin. There should be no changes in pigmentation. Okay, and the hair covers the skin on the legs and appears on the dorsal surface of the toes. Legs are free of lesions or ulcerations. Also, the feet are free of lesions or ulcerations. Okay, so identical size and shape bilaterally, no swelling or atrophy, no edema, fitting or non-fitting present in the
Okay,
legs.
so if client has edema, determine whether it is pitting or non-pitting. Okay, and then next is palpate skin temperature using dorsal texture of the hand.
Toes, feet, and legs are equally warm bilaterally.
Okay, and then next is palpate the superficial inguinal lymph nodes.
Non-tender, movable lymph nodes up to 1 or even 2 cm are commonly palpated.
Okay, and then next. Okay, next is palpate and auscultate the femoral pulse.
Femoral pulses are strong and equal bilaterally. No sounds auscultated over the femoral arteries. Okay, next, palpate the popliteal pulses, palpate the dorsalis pedis pulses, and palpate the posterior tibial pulses. It is not unusual for the popliteal pulse to be difficult or impossible to detect, and yet for circulation to be normal. Dorsalis pedis pulses are bilaterally strong. This pulse is congenitally absent in 5% to 10% of the population. The posterior tibial pulses should be strong bilaterally. However, in about 15% of healthy clients, the
Okay,
posterior
so
tibial
next.
pulses are absent.
Okay, next is inspect for varicositis and thrombophlebitis.
Veins are flat and barely seen under the surface of the skin.
Okay, so next is assess for arterial or venous insufficiency.
Special test for arterial or venous insufficiency.
Okay, next for manual compression test. Okay na?
Lastly, perform Trendelenburg test. No pulsation is palpated if the client has competent pulse. Spontaneous vein fills from below in 30 seconds.
So that's all for our procedure. So for aftercare, we'll formulate nursing diagnosis, formulate collaborative problems, and make necessary referrals. Okay, so ma'am, we are done po for our procedure. So thank you po for your cooperation and collaboration. So Ano po nararamdaman mo? May anything na masakit po ba sa inyo? Okay, so thank you very much po. Okay, so magpapaalam na po ako sa inyo. Okay po? Okay, so that's all po. Thank you.